Thank you, Honorable Chairman and Committee, for allowing me to have the opportunity to talk to you today. I'm Ann Schultz, and I am a physician assistant. I've been practicing clinically for 34 years. The last 8 years I've spent in a federally qualified health center. We have a critical health care shortage and problems with access and providers here in the state of California. What SB352 will do is it's going to expand the role of medical assistants by allowing both physician assistants, nurse practitioners, and nurse midwives the ability to supervise medical assistants in clinics throughout our state. MAs provide a cost-effective means of providing health care within our communities, and as Senator Pavley did highlight, SB352 does not change the scope of practice of MAs or physician assistants and NPs. In my role in my clinical setting at El Proyecto de Barrio in Azusa in Southern California, because we are a licensed federally qualified health center, we're under HRSA's Section 330 and the California Health and Safety Code 1204, which means that I can indeed supervise medical assistants in my practice currently. It's in my delegation of services agreement with the physicians that I work with to provide supervision of MAs without a physician on site. This expands our ability to meet the healthcare needs within our community greatly. El Proyecto de Barrio has 5 clinics. My practice in Azusa in 2012 actually saw 1,200 patients a month. The clinics overall, 137,000 patients last year alone, and that's 36,000 patients per year total. Approximately 85% of our community that we serve are underserved or underinsured. In our clinic, in my clinic alone, currently we have 1 full-time physician position that's been open for 2 years now because we can't fill it. There aren't enough primary care providers to fill that position. We have 3 full-time PAs and NPs, 2 registered nurses, and 12 to 15 full-time medical assistants. Without SB 352, if I was in a community clinic, I would be severely compromised in my ability to meet the health care needs of the patients within Azusa and the surrounding areas. I practice medicine without a physician physically on site. If I was working, like I said, in a standard community clinic, I could continue to practice medicine but could not have an MA to do patient intake, vital signs, and many of the other clinical services that the MAs provide. The Office of Statewide Health Planning and Development shows that there are 19.5 million people living in areas where there are primary care shortages, where we don't have enough clinics or primary care providers. We have a critical shortage of both clinics and providers in primary care throughout California. Restricting our ability to practice makes this problem worse, not better. Anything we can do to increase our ability to provide health care and access to primary care is essential. Thank you.
Thank you. Other witnesses?
Thank you. My name is Linda Sanfilippo. I'm a family practice physician assistant with Healthcare Partners in Southern California. I'm here in support of the bill as well. Thank you very much. We all understand that the shortage in healthcare affects all of us, and that the influx of the patients that are coming into California's managed care is going to take a team approach. So you've heard testimony from someone who has the ability to supervise medical assistants. I, in the Healthcare Partners system, do not. I fortunately have physicians on site who are always there, but if I did not, I would not. I'd like to take you into just a moment of my day with my medical team. My physician assistant support is with other providers. My medical assistant is Rhonda, and she is the most important person in my practice to me. She sets the tone and the tempo for the day. She gets the flow of patients. She takes calls. She makes sure that I'm on time. She assesses patients' needs. She lets me know if somebody doesn't look quite right so that I can quickly go to their side. She checks vitals. She calls for referrals. She manages patients' labs. She checks pharmacy, does refills, organizes supplies, comforts patients, and she makes me laugh with a touch of humor when the tsunami of work tends to overwhelm our day. I couldn't do the work if I didn't have her there. Under the law that we have now, if there was not a physician on site, this work would stop, and that the flow of patients would stop. Asked to see more patients in my future is a reality, and I cannot do that job if I don't have adequate staffing. Utilizing RNs and LVNs in this space is not medically skill set for the LVNs and the RNs, nor is it prudent use of my finances. Without the clinic support, patient care would stop. Opposition to the bill opines that this will shift licensing nursing functions in order to shuttle more patients rapidly through the clinics. Physician assistants in California have worked too hard and too long to be acknowledged as the professionals that we are to jeopardize that. We supervise our medical assistants, and we would not allow them to proceed unsupervised, unchecked, or to open our practice to fragmented medical care. We at Healthcare Partners, as are all medical groups in California, are graded on our performance for quality and for quantity. We've proven you can actually have both, and that they are not mutually exclusive. It is my ability to utilize my MA that will keep these health measures high and my patients healthy. Thank you for your support and attention as we consider support for Senate Bill 352.